welcome you all for the Tackling Childhood Obesity seminar. As you know, we are in a global epidemic of obesity. Next, please. So according to the estimate, currently there are 2 billion people globally with obesity or overweight. And unless urgent action is taken, this incidence is going to rise to 2.7 billion by 2025. Next, please. So in 90s, our TVs were bulkier and we were slimmer. Now the other way around. Next, please. However, one of the worrying facts is the childhood obesity. Currently, 60% of the population are either obese or overweight in adults. However, this is going up to 20 to 25% in children. Next, please. So what are the key facts according to the WHO? So the worldwide obesity has nearly tripled since 1975. Currently, there are 340 million children between 5 and 8 which are overweight or obese, and 38 million children under age of 5 are overweight or obese. However, the key fact everybody sort of understands that obesity is preventable. Next, please. So what is the incidence of current childhood obesity in UK? So almost 1 in 10 of 4 to 5-year-old are obese or overweight when they enter the primary school. And when they come out of the primary school at the age of 10 or 11, it pretty much doubles the incidence of obesity. And we estimate that 1.4 million children in the UK are obese or overweight. And the worrying fact is that it pretty much doubles in deprived areas of the country, more so in Greater Manchester. Next, please. So what is morbid obesity? It's pretty much a chronic disease of excess fat storage, which is sufficient to harm one's health. It's not just simply the result of overeating. It is a complex disorder involving appetite regulation and energy metabolism. And the causes are multifactorial. Next, please. So there is not a single organ of the body which is free from the wrath of obesity, starting from the head to toe. You can have intracranial hypertension, stroke, cardiovascular risk, diabetes, which is getting worse, and people with young children are found to be diabetic. There is liver disease and increased incidence of cancer. Next, please. So what is the impact of obesity on health? It increases comorbidities or other diseases because of the obesity. It reduces one's quality of life. There is increased chance of bullying, stigmatization, low self-esteem, anxiety and depression. There is increased chance that our children will die before us. And currently the obesity costs to the NHS 5 billion in direct cost, and indirect cost to the economy could be up to 15 billions. Next, please. So the Foresight report came in sort of around 2007. What they did a systems map, which made it very clear that energy imbalance is at the root of the obesity. And the rise in overweight and obesity is due to many years of positive energy balance. So there's a great interaction between biology and the environment we live in. And because of the so many choices, it is struggle to get the weight right. In addition to there is peer pressure and behavior. Next, please. We are surrounded by highly dense, rich calorie food. Next, please. By telling someone that willpower and exercise is enough, probably not, especially in childhood obesity. Next. So telling someone eat less, exercise more, control your appetite, or take your personal responsibility, especially when we're surrounded by highly pleasurable physiological response and energy dense foods. And currently there is abundant, frequently cheap and convenient food to buy than to get the fresh produce which are healthy. And this troublesome combination makes one difficult how much you eat of them. In principle, it is a recipe for poor health. Next. So you can see this a roadmap starting from 1930s as the incidence of obesity across the globe started increasing. Especially surgeons and physicians started noting that especially when a part of the stomach is taken out in the past for a cancer or a ulcers, or a part of your small bowel is taken out for trauma or for hernia where there's a bowel is gangrene, people start noticing that these patients lose weight and they do not regain weight. So surgeons started working on it. So in started 50s, it started what you call the weight loss or metabolic or bariatric surgery. And then there is more and more evidence and randomized trial. And then now it has become a standard of care published in the Diabetic Care recently. And because of the stigma with obesity and now it is, and the benefits of metabolic benefits of surgery, it is now called metabolic surgery. So what is metabolic surgery? Metabolic surgery is the use of gastrointestinal tract operation with the intent to treat obesity and diabetes. Next, please. So you can see a patient can lose significant weight after surgery, even after many years of surgery. Next, please. And John, who was struggling to walk, now he can do marathon. Next, please. So how do you tackle this childhood obesity? We know currently there are significant number of obese children with a lot of health issues. Unless we do something, they will have a poor quality of life and they may loss of their length of life. So we need to have effective treatment. And currently there is no medical effective treatment. Having said that, I'm not encouraging surgery, but our key aspect of management is prevention because it is a preventable disease. So we need to have physical activity and we need to think of affordable, easily accessible, healthier dietary choices. And the food industry has a significant role to play in promoting diet with low fat, sugar, salt content of processed food. There is a significant role of social media and advertisement. So my subsequent speakers will try to elaborate on these aspects of prevention. In essence, we need a conducive environment to tackle this epidemic of obesity. Next, please. So we don't want to see this. What do you have with no fat and no sugar? Napkins. Next. Or this sort of percentage discount depending on your how much you weigh. Next, please. So the purpose of obesity awareness or OASIS which we created a few years ago is to increase the awareness both in health professionals and the general public. We want to work with everyone and all the institutions who want to tackle obesity, as our motto is active living and healthy eating. Next, please. So I think we've seen this slide. So this is what we encourage the support of our colleagues along with the patients who lost weight, either that surgery or they lost weight by exercise. And we want to increase the awareness. Now, not only they lost weight, now they become a community advocate to tackle obesity. So that's why to encourage them, we created this trophy called the OASIS Champions. Next, please. And we encourage all the people who lost weight and now they become advocate. Next, please. Next. And this is people who lost weight and our team. We have a variety of team, as Jack has mentioned before, who contribute to our group. Next, please. So in essence, obesity is going to kill us. It is a preventable disease. Whenever we struggle with a problem, we go to basics. And the basics are ABC: adopt new healthy habits, balance your calorie intake, and control your weight. Thank you. Next, please. Thank you.